Well, welcome back to Coffee Chat. I'm pleased to have as my guest today Jodie Ginter, and I want to thank you for taking some time out to come down and visit with us and say hello.
Thank you for having me.
And we're going to introduce the subject momentarily.
Okay.
And we'll have you get involved, and I mean really involved, because you're the one that's got the knowledge today.
Oh.
This is a subject that is very near and dear to Jodie's heart, and I have learnt of it through Jodie, but was aware of it by other means, and those means we'll bring to light later. But I just want to introduce the subject to you as to what it's about. And we are talking about over 6,000 Canadians become permanently disabled by an acquired brain injury. And that's what we want to basically discuss here for the next 30-40 minutes, is brain injuries. And Jodie is in a position to discuss that. So having said the introduction, would you care to introduce why you have become a spokesperson for brain injuries?
Yeah. Well, first of all, it started in 2006, I believe it was. Nope, sorry. It started in 1996. And my dad had had an accident.
Mm-hmm.
And I hadn't heard anything at all. I never knew what a brain injury was. My dad was beaten up and was left a quadriplegic, a limited mobility quadriplegic, which means he can somewhat move his left hand, and with severe brain damage, and he was in a coma. So I learned quite a bit in a very short time as to what he was going through. He was in Edmonton, and so we still lived here, so it was really hard to get like a real grasp as to what was happening. So then in 2006-ish, 2005, I went back to college, both Dennis and I, and I was doing my education assistant certificate, and we had to do a major paper, and my term paper was at this time, well, I'm going to do brain injury because I want to know more about what my dad has. So I did what I could, I learned what I could, and because there's just so much information, and because every brain injury is different, it was really hard to connect a lot of stuff to my dad, and because I didn't see him on a daily basis. Then as I was doing my presentation for my course, I was standing in front of my class, 20 girls and my teachers and that, and I'm doing this, and as I'm reading this and I'm going through all these different side effects and issues that people deal with, it suddenly hit me that, oh my goodness, I live with one of these people. And it's my husband, who in 1990 was in a very serious car accident where his truck hit the second engine of a train, and he and his friend were thrown from the car, and his friend didn't make it, but Dennis has, and he's had memory issues since then, and just other side effects and issues that he lives with, which brought me through to 2008, where my son, a lot of people know, Samuel, was shot in the head at close range with a .22 in a totally freak accident, which brought me again into learning more and more about brain injuries and how they change people's lives, and not just I guess, and that's why I'm a spokesperson, because it's not just the survivor, how it affects the caregivers and the entire family, and then how it affects even the outlying family.
Well, part of the discussion, of course, is that it has very much of an impact on people who live with, and that includes the either and or. We'll use the role reversals here of the husbands and or the wives and also the children, but more importantly, it also is into the mother, father, God willing, then they're all still alive, and it also impacts on relatives. So how do, and that's one of the things that was often said, that sometimes there's, because it's not a visible thing, it's very hard to work with.
Yep.
So let's talk about that aspect of it for a moment. How then did you, or were you able to, not yourself, let alone educate in a hurry, but cope with it? Like how did you work with other members of your family? Because the diagnosis sometimes is different for everybody.
Right.
So how do you work with that?
Well,
great deal of difficulty, probably.
Yeah, it is. For me, it was a lot of, because I had the background already of my essay that I had done, my term paper on it. I had the background, so I was going through the different websites that I had learned from. But a lot that I did learn was that with brain injuries, sometimes it's quite a bit like, it'll be like somebody with Alzheimer's here, and over here it'll be like somebody with MS, and over here it's like somebody with autism. So I kind of took things from each of those aspects of learning, and literally it's trial and error. With Sam, he had lost peripheral vision in his left eye, and his whole left side was paralyzed actually. So we needed to do something that would work for him, but that would intrigue him or keep him engaged. So while we were in the Winnipeg in the hospital, we bought him a DS, and it had Guitar Hero on it. So he had to hold it with his left hand to get his fingers moving, and he had to use his right hand for eye-hand coordination, and it was something he was interested in. He was 12 years old, and I like this.
Sure.
My husband, if he needs that, that just doesn't work. So you have to find literally what each person is into. And the thing is with a brain injury is once after the brain injury, things that they were interested in aren't necessarily an interest that they're going to have now, like after an injury. So it's really, really hard because you have to go with who they are now and try and connect a little bit to that person so that they don't totally lose who they used to be.
Yeah. Did you have any trouble in connecting, as they say in medical terms? Were you able to connect the dots such that there was no loss of memory?
With Sam, for the most part, yes. My dad, for the most part, yes, with everything except me.
Right.
He doesn't, I'm an only child.
Okay.
He doesn't remember me probably 98% of the time. Once in the 16 years since his accident, he has actually called me. It was actually just within the last 2 years probably. We said, do you know who I am today? And he said, Jodie, Holmes. And then he yelled out at the top of his lungs, Ginter! And we kind of went, wow, like where did that come from? Because I've always been one of his sisters, or like I've never been my mom, which shocks us because I look a lot like my mom. I've never been Hannah, and Hannah looks a lot like I did at her age. But he doesn't have much recollection. He doesn't remember my wedding, but he remembers Dennis's wedding. So we say, you know, did your first wife leave you much money, or, you know, is there anything? And Dennis, no, it's just you, just you. But
they often say that those who have been touched by a brain injury are often very misunderstood. I gather that statement is made only because there's a lack of understanding. Like the educational aspect is not all that great right now because there, and we'll get into this in a few minutes because we did talk about it pre-show, there's maybe not enough out there for people to get their teeth into, to be able to grasp.
Yes, definitely. And it also goes back to the fact that for example, in our family, it was really hard for Dennis to grasp the concept that he had had one because, and for me too, because when you look at my dad, you physically and visibly can tell that there's something wrong with him. With a brain injury, like we were actually in the downtown Neepawa here one day, probably about a year after Sam's accident, and somebody came up to me and they were like, oh my gosh, Jodie, how's your son Samuel? And I said, he's fine, he's right here. And they're like, oh my gosh, you know, and then they were, right away it was, oh, I'm so sorry, you know, like apologizing to him that they were, but because you can't see it for the most part, that's the biggest part with the awareness parts that we have problems with, is that people will just go, it's like, you know, when you see a 3-year-old throwing a temper tantrum, you don't know what's going on at home. For all you know, he has a brain injury, this little boy, and the mom is walking away or, you know, saying whatever she can do. You don't know. You just, it's really hard to explain. You can't see it, so it's really hard to convey. It's like they need to wear a button that says, I have a brain injury.
Sure.
And I hate always using cancer as an example, but you know, somebody has had cancer and they've gone through chemo treatment, they lose their hair, or they lose weight, or you can tell by looking at them. So people are more willing to go, oh, okay, well, I'll look that up. But because it's the brain, there's so much stigmatism. As soon as you have a brain injury, well, you must be stupid, or there's something wrong, like really wrong with you, and that's not what it is.
That's the font of the front. I mean, those people don't understand, because then we're talking about, going back to what we said, lack of education. Let's work on this aspect of it about you are around these people 24/7. So you can see and be the better judge of their getting better at whatever you want them to work with in order so that they can improve.
Right.
That's not something though that you can tell to the next door neighbor, or you can tell to the people at the school.
Exactly.
That's in a different case too. Maybe the teacher can see it, but how do you measure progress?
How do I-
Probably an unfair question, but
yeah.
it just popped at me because I know it's a story like if you took baby from childhood, you got to crawl before you can walk, before you can run. Right. So this is why I sort of propose it to you. But if you wish, we can always move on to another one.
No, actually, with Sam, every day for us is a progress, because our initial prognosis with him when he wasn't even in surgery yet. We were sitting in the ER. The doctor said to us, he will probably walk with a limp and drag his left foot. He will always have a noticeable slacking of the face.
Right.
He will never play football. He will never be a pilot. He will never be a carpenter, because he had lost his peripheral vision in his eye.
Right.
And because of the dragging of the foot and the physical stuff. He will most likely have brain damage. So
for the rest of his life.
For the rest of his life. This is what they told us. We had been in the hospital all of about 25 minutes, I think, about that point. And I went, no. So I'd asked the doctor a couple of questions, and he says, "Oh, are you a nurse?" I said, "Well, no, I've already been through this before with my dad. I kind of know, that's extreme. My dad is sitting here." I said, "My son is going to be over here." So we do have that kind of a measuring stick for Samuel.
Sure.
In that we know what the doctor said, and
Sure.
we know where he was before the accident.
So I have to ask the obvious. And I think I know, because we talked about his position in life as we know him today.
Yep.
He's not dragging his foot.
No.
He is playing football.
He is playing football.
And he's working towards that pilot's license.
Yeah, he wants to become a pilot's license.
Yeah. So that I guess if there's a will and a way and you can climb the mountain, you'll find a way to do it.
Yep, and and a lot for him, it all came down to him. He set goals for himself. He was going to be back in school. The accident was July 29th. We were home within 12 days. He went from 112 pounds a day of the accident to 87 pounds the day we brought him home. He was still learning to walk. He was learning to talk with the muscle, because he was quite like a stroke patient.
Yes.
That's where I say you go back and you relate a lot of their stuff to other issues.
Yep.
And he was going to be in school by November. Well, he was in school by October, part-time, whenever he could handle going with a student mentor. So, and then it was, well, he wanted to do this. And so then, he set that goal, and he worked and he did it. And we just kind of sat there and went, wow, like.
Yeah. But we've talked about the progress in the positive ways.
Right.
And that's because of the motivation that's given them and the things that they're asked to do day by day by day to work it in gradually, so that you're not putting pressure on the brain.
Yeah.
But let's talk about, if we could, just for a minute, because I know you've had those days, you personally, because of your work with them, but also them too. Not every day can be a perfect day. Not every moment can be a perfect moment.
Right.
So there still is some trauma within.
Yeah.
So talk about that just for a moment.
Yeah, for us, every day is a challenge. It's we call it our new development. This is our new development for today, and every day there is a new one. And if it's a new development that we get up and everybody is clicking right along and everything's going, we just go. And if it turns out that, like I had wrote one day that I write articles for Lash Publishing down in the States about brain injuries and their blog style. And I said, for me, it's when do you stop caring too much? Because Sam will wake up and he'll say, and I said, are you sure you're okay? You look like you're having a rough night, and maybe you should stay home. No, I'm fine. I said, are you sure? Yeah. Well, we live 30 miles from the school, and about 2 hours later, I get the phone call. Hi, Mom, I need to come home, and I can hear it in his voice, and it's just like, oh, okay. So then we just have to readjust. And everybody in the house has to readjust.
Yeah. But a setback, if we call it that, or having a bad day, or having a bad hair moment, you can relate to that.